Hello, welcome. My name is Dr. J. Michael Bennett. I'm an orthopedic sports medicine physician practicing in the Houston, Katy, Sugar Land regions. I am a sports medicine trained physician. I did my fellowship at the University of Miami at UHZ Sports Medicine Institute. I also finished an orthopedic surgery residency at Baylor College of Medicine. During my fellowship and during my residency training, we did a fair amount of shoulder injuries, or took care of a fair amount of shoulder injuries. One of our specialties here at our clinic is dealing with shoulder injuries, particularly in active adults, and our end result is to get you back to your quality of life. During my training, I have dealt with everything from the elite athlete to the weekend warrior to a baby boomer who's just trying to pick up their grandkids. We see everything from shoulder bursitis, which is just an inflammation of the shoulder, to fractures of the shoulder, including a clavicle fracture or a proximal humerus fracture, which is the top part of the shoulder, to any kind of tendon injury, which is any rotator cuff injury of the shoulder, or biceps injury of the shoulder. We also see shoulder instability in a lot of our younger athletes that have recurrent dislocations of the shoulder. I've been in practice now for 7+ years in these areas, and we have done hundreds of shoulder procedures. We want you to be informed. It is our goal here to make sure that you're educated on your disease process, on your injury, and step by step explain to you your options. And I want to make it clear that surgery is not the only option, and there are other options in addition to surgery. As a matter of fact, the majority of injuries we see are treated without surgery. It's just a matter of either changing your technique regarding your tennis swing, or how you hold a bat or a tennis racket, or just strengthening certain muscles in certain areas, or even changing your shoe wear. This actually can make a big effect in the kinematics of your body, which in turn affect the rate of injury. So many of these things just need to be explained to the patient, and we want to make sure that you understand this. And like I said, the majority of the injuries that we see can be prevented, and oftentimes surgery is not indicated. But if it is indicated, we want to make sure that you are comfortable with proceeding with surgery, and you're comfortable with our office and with our abilities, and that you understand every step of the way, from the preoperative process to the surgery itself to the postoperative process. You will be educated on how the injury occurred, in addition to the anatomy, in addition to the plan, and we will go through each option of the plan. There's always a plan A, B, or C in case something else is identified during the procedure. And then we will extensively discuss the postoperative course, which is actually outlined in a specific protocol that you will be given postoperatively to take to a licensed physical therapist in your area. So once again, we just want to make sure that you understand that we want you to be comfortable, and we want you to have a very good understanding and be very well educated on your pathology and your injury, so that you feel confident in making the decision to choose us. And we would feel very honored and privileged to have you as a patient. So please feel free to call our office at 281-633-8600 for a consultation, or feel free to visit the website at jmichaelbennett.com or orthopedicsportsdoctor.com. Thank you very much.